Hi, I'm Sarah Myers. I'm a child care health consultant with Child Care Aware of North Dakota. Today I'm going to be talking about how to wear a mask in a child care setting. And things I would like you to remember whenever using a mask is one, whenever you're going to enter a classroom, please put it on before you enter the classroom. And then also always put it on before you're ever going to be within 6 feet of another person, whether a child or an adult, just so you always have that in place at those times. Also remember, it's really important to always clean your hands. Either wash at a sink, which is recommended because that's always best, but if you don't have a sink available, please use hand sanitizer whenever you're going to be touching your mask for whatever reason, whether you're going to be putting it on, whether you're adjusting it, or whether you're taking it off, just so you're always making sure your hands are clean. I'm also asking if you can please remember to avoid touching your eyes, your nose, or your mouth, just because this is where germs are, obviously. Also, always try to remember to limit as much as you're touching the mask itself, whether the side that goes to your face or the outside of it. So try to always touch, at the straps or somewhere else, just so that we're limiting contaminating our mask as much as possible. And then also, please, could you label it? Just because that is important, just so you can always make sure you know which mask is yours or the individual's mask, just so that there isn't anybody mixing them up. So now I'm going to demonstrate how to put on a mask. And it's really important to do this correctly, just because that way it is more effective. So like I stated, it's always important to wash your hands or clean your hands before I'm going to handle my mask, which I'm going to, and I don't have a sink right here. So I'm just going to use hand sanitizer and make sure my hands are, and always remember to, whenever you use hand sanitizer, make sure your hands are covered completely, rub till dry, and always keep out of the range of or reach of children, just so that they're always safe too. So once I've done that, then I'm going to take my mask. And things that I'd like you to really remember every time you're going to put it on is that I'm grabbing at the ear loops. This is a design that's a typical design. A lot of people are wearing this type of design. So it's just the ear loops I'm handling as much as possible. The other thing to always remember is that you want to cover your chin or your mouth and your nose, because your mouth and your nose are where droplets come out, and droplets are what we want to prevent from spreading. So that's what happens when you are coughing, sneezing, you're singing or talking. That's when droplets might come out of, or potentially, or do come out of your mouth and nose. So we want to make sure that we're preventing that from spreading anywhere. So when I am going to put on the mask, then I'm going to show you how to do that. If you can, I'm holding at the ear loops. Try to scoop underneath your chin, because then you already know that that's covered. And then you want to bring it up and then loop it around your ears, which I'm going to try to see if I can do properly. You get that secure around your ears. And then you want to make sure that I have glasses on. So if you do wear glasses, they fog up. They're fogging up right now. So this is not a fun thing, and you won't be thinking this is fun to wear it. So if you can, then obviously make sure that you have a good seal around the top part of your mask. And I'm limiting as much as touching as I can, not digging underneath it, but just on top, pressing it along my face so that way I am preventing the fog from coming up. And then making sure my glasses are adjusted how I like them and I feel comfortable. So as I can tell, my glasses aren't fogging up. Then I also want to make sure that I have a good seal, per se, that it fits at least, closely to my face, that I have no large gaps anywhere on the sides of my face. That's important too. So as you can tell, I've got my chin covered, or my mouth, my nose is covered. I have my sides, no large gaps. My glasses aren't fogging up, so therefore I'm able to go into my classroom. So then, but I'd want to make sure, because I just touched my mask, I have it in place. Always make sure you wash your hands or use hand sanitizer like I'm doing, because I just adjusted my mask. So I would really like you to try to keep on your mask as much as possible in the classroom. And I know they're not fun to wear. I know, I understand, but we'd really like you to keep it on as much as you can, just because, like I said, we want to prevent those droplets from spreading throughout the classroom. But there are going to be times that you need to take it off, like if you need a drink or if you need to blow your nose. I just don't want you to be miserable either. Nobody expects you to be miserable. So then just kind of remember that where you are when you're going to take your mask off. Just try to remove yourself from the area. You still want to be supervising, but just make sure, can you be 6 feet away from another staff member or another child when you're taking it off, just to try to be in that protective factor of making sure that you're protected. When you do take your mask off for, like I said, whatever reason, then just things to think about once again would be that you want to make sure that when you're taking it off, please avoid touching your eyes, nose, and mouth. Try to avoid touching the face side or the side that's had contact with your face, because that's where your germs are, because you've been blowing or breathing, maybe sneezing in it. That's where the droplets are. So you want to grab where the ear pieces are, and then try to put the face side together. So you kind of just keep all the germs folded in together. And then you would hold it at the edges if you can. And then that's where you'd want to put it somewhere that can't be touched by another person, so just try to think of where would that be. Some people use 3M hooks, so you can put them on your wall, and then you can, those don't hurt anything, and then you can hang the masks on. You could also take a plastic bag and you could put your mask in there, putting that in a plastic bag. Another option would be taking a paper bag, and you can use that as well to put the mask in. And you could also use a paper barrier, whether that be a paper towel. You could use a piece of paper, you could use a napkin, you could use a paper plate, just something that's disposable that you could throw away. But then you also want to make sure that those items, wherever you're putting that, are also not in the reach of a child. So please make sure that you do have your hooks up high enough so children can't reach them. If you're going to be putting them on a barrier, where's that barrier? So putting on a countertop away from a child from grabbing them, because we just want a child to go grab it. Where are your bags? If you're placing them in a bag. So just be mindful of where you're placing them. And then you just also want to make sure that you, obviously, when I took my mask off, you would want to make sure that you wash your hands or clean your hands after you take it off. But say it's for an instance that you are going to just blow your nose, so you know that you're going to put your mask right back on. So something you might find helpful is that you want to take it off and then just place it on a paper barrier, because that would be within your reach. To take a paper towel, place it on the countertop, and then you take off your mask, obviously, place that on the paper towel, and then you'd want to blow your nose. And then obviously you'd want to clean your hands. So you either would use hand sanitizer or you'd wash. Washing at a sink is always recommended, but if you don't have that available, like I said, hand sanitizer. Then after you've done that, then your hands are clean, so you're okay to touch your mask again. And then you want to make sure you put your mask on. And then once you have your mask adjusted, then that's when you'd want to clean your hands again, because you touched your mask and you put that back on. But once you have that, could you wash your hands, please, or use hand sanitizer? So just to think about that as well. And then also just through the day, if your mask ever gets wet, either from sweat or gets wet for any reason, feels moist because you're coughing or breathing, feels warm, whatever, it is recommended to replace it, just because that is something that could be a source of germs, may not be able to breathe as well just when material gets wet, so you would want a clean, dry one. So just try to keep extras through the day if you can, to always have those available. And then please remember, it's really important to launder them. So make sure that you're washing them daily, just and not re-wearing them day after day, just because that could be a source of germs as well. So laundering is really important. I do want to remind you all that please know if you have any questions about masks or any other issues around COVID or any other health and safety issues, please know that Child Care Aware is here to help you. You can contact our health consultants, and we will help you either guide you to the right resource or answer your question.